I feel like it's my job to put context on it for you. And really, I can't think of any context for these things except to attach stuff, to attach them to each other, or to attach things to them and talk about how they work. So this is as good a place as any to jump in at the shoulder. So this is a lateral view. This picture's not in your book, but it's a lateral view that I like to use to introduce the shoulder to students. Now, I have not defined different kinds of joints yet. I know that. But you guys know what a joint is. Now, you don't have the three major categories yet. You don't have your fibers, cartilages, and synovial in your mind, and that's okay. All I want to do today is try to keep you interested in anatomy so that you look at this and you go, okay, I'm starting to see how this thing is put together. So you've learned now about the scapula. You've learned that the scapula has a spine, it has a acromion and a coracoid, it has a supraspinous fossa and an infraspinous fossa. And you've heard out of my mouth that these are important places for building the shoulder. You've also just seen from me the major pieces on the proximal end of the humerus, the major parts of this bone, the greater and lesser tubercle, and you know where they are. In fact, you've already heard today about why the greater tubercle might be bigger and why it looks more massive from the back, why the anterior tubercle is a little bit smaller, and what that groove is between it. All right, so let's talk about some stuff that's there, some stuff that will clinically sound more familiar to you. All right, so this is a lateral view of the proximal end of the humerus. The deltoid muscle has been removed. So in this picture, you're seeing muscles around the shoulder. You're seeing muscles around the shoulder from a lateral view right here. But in a dissection, if you were to cut the shoulder, you would have to go through this muscle first. This muscle is called the deltoid. Now, have you seen that word already today? The deltoid tuberosity. Was that on the front or the back of the humerus? On the anterior side, right? So if I'm going to show you this, I must turn this way, and then what should I do with my arm? Right, Danny. I got to do this, right? Because now it's on the front. Slightly lateral, but on the front. That's where the attachment of this large muscle is. The deltoid attaches to the clavicle. It attaches to the spine. There's a picture of it coming, so you can write it down now and you can see it again. The clavicle, the spine, and to the deltoid tuberosity. Let me ask you, do you think this muscle offers any stability for this joint? Does it in fact help keep the head of the humerus in the glenoid cavity? It does. Exactly, it does. Now, if the fibers of that muscle contract, so it's lateral and anterior, if the deltoid, if the spine and the clavicle pull on the deltoid tuberosity, what does my arm do? You flexed your elbow. The deltoid is not attached down here. So if the attachment is more anterior, when the deltoid contracts, the clavicle pulled on it, I would tend to do this, right? And that is called flexion at the shoulder. The deltoid is also a major, the bulk of the fibers are actually posterior and on top, superior. When those fibers pull, what does the arm do? It does this, yes? And this is a special joint movement called abduction. So the deltoid here, and its attachment, which is not shown here, I have it coming more, we've got to do it again, does anterior flexion and abduction. We have to learn all these words. I'm just bringing them up. We'll bring them up again as we get to them. Okay? So if I remove the deltoid now, and I look at what is then attached underneath, deep to the deltoid, I find, can you see it? That there is a ring. Anatomists describe it as a cuff rotating around the head of the humerus. Its name is the rotator cuff. And it is essentially the tendons of 4 muscles, all of which have been mentioned to you today. The top one is called the tendon of the supraspinatus. The supraspinatus is the top muscle of the rotator cuff on the shoulder. This cuff is arguably the most important thing keeping the shoulder in place. So the first one on top is the supraspinatus. Where is the attachment of the supraspinatus on the humerus? It's on the top here. Yes. It is on the greater tubercle. It's the top one on the greater tubercle. Where is the origin of this muscle? Where on the scapula? See why the vocabulary is important? Where?
The spine of the scapula.
No. Good guess. Where, Rodney? In the supraspinous fossa. The supraspinous fossa to the greater tubercle, the supraspinatus. The next one down is the infraspinatus. Is the infraspinatus lateral or medial to the attachment of the supraspinatus? Lateral. Can you give me another anatomy word? Where is it? From the supraspinatus, where is it? It is inferior. Well done. It's lateral inferior, so I'm working around the cuff now. The infraspinatus. Where do you think the attachment of the infraspinatus is on the humerus? It's on the greater tubercle. This is the second one, right? Where's the origin of this muscle? This one, the supraspinatus, was in the supraspinous fossa. This one is called the infraspinatus. Where is it? In the infraspinous fossa. Exactly. You see why those vocab were important? 2 big ones. The next one on the list is the teres minor. You can see the teres minor. Where is it attached on the greater tubercle? Where is it attached on the greater tubercle? Where is it in relationship to the infraspinatus? It is lateral and inferior. Yeah, so I'm working around the cuff. So these are the big 3. Lateral, superior to inferior, and lateral. So, is it going to be easy for me to move the head of the humerus superior and lateral? No, that's not the way shoulder dislocations go. And this helps me explain it. These 3 large muscles of the rotator cuff. Now, you don't know this yet. I'm going to say it. I'm going to show you some more pictures. This one is attached to the lateral border of the scapula. The lateral border of the scapula. It attaches here to the inferior portion of the greater tubercle. All right, let's work our way now around to the front. So, notice on the front side is the tendon of a muscle called the subscapularis. Where is the subscapularis attached? On the humerus. It's on the front. It's more medial, right? It's on the lesser tubercle. It is the only muscle attached to the lesser tubercle. 3 big ones on the greater tubercle. Massive. 1 on the lesser tubercle. This attachment is anterior and superior or inferior?
Inferior.
Compared with its cousins on the greater tubercle. This attachment is more inferior. That's right. So from here, You actually work down toward the attachment of the subscapularis. It is the only muscle of the rotator cuff that is anterior and inferior. So, where do dislocations normally happen? This is the easiest way to explain it to somebody. Where they normally happen? Anterior and inferior in this direction. It's easier to get it out on this side. Now, it's not easy to get it out, right? But easier, because the massive support is here, lateral and superior. Anterior and inferior, much less in terms of support for the shoulder. So if you want to move the head of the humerus out of the glenoid cavity, raise your arm this way, and a sharp blow from the back at this angle, anterior and inferior. That is the easiest way to move that head out of the glenoid cavity. And these muscles explain it. All right. Here they are. The supraspinatus is in the supraspinous fossa. The infraspinatus is in the infraspinous fossa. And the teres minor is attached to the to the lateral wall of the scapula. So, can you name some things for me? What is the name of this right here? That is the acromion. And this is? That's important, right? Is that the clavicle or is that the spine? How'd you know? Yeah, the clavicle's on the anterior side, and we're looking at the back. All right, so there's the three big ones right there, supraspinatus, infraspinatus, and teres minor. And here's the one on the front. There's the teres minor right there. Now, what is the name of this bone right here? That's your clavicle. No, that's not your clavicle. I missed that. This is the acromion right here. The clavicle's been taken off. So that's muscle attachment. So what is the name of this muscle then? Subscapularis. What is the name of this bony process right here?
Lesser tubercle.
Lesser tubercle. What is the name of this bony process right here? Greater tubercle. What is the name of the groove right here? Intertubercular groove. Now, that right there that you're seeing, it looks like a tube. And it's a pretty good description. There's a tube around the tendon of the long head of the bicep that goes through there. We're going to see it several times. Now, let's back off of this like we did in the laboratory and talk about some of these. The red pictures, the red part of the picture is muscle origin. The blue part of the picture is muscle insertion. My requirements of you will be to learn attachments of muscles. Okay? So I'm just orienting you for this muscle, for these bones. I want you to see the bones that we've been talking about, and I want you to start thinking about the things that are attached there. And the easiest way to do it is to color code it red and blue. So let's first of all review the ones we know already. This one in the supraspinous fossa is called the supraspinatus, and it goes from here, right, deep to the acromion and attaches right there. The infraspinatus comes from here, infraspinous fossa, across here and attaches right there. And then the teres minor, which attaches to the lateral border of the scapula, comes across and attaches right there. Lateral, superior support. Supraspinatus, infraspinatus, teres minor. 3 of the 4. Why is the subscapularis not shown on here? It's on the other side. That's right. Okay, now, a couple other ones that we mentioned. I told you on the last picture that this muscle had been removed. And I told you that it is attached to the spine of the scapula, and it is attached to the deltoid tuberosity. So why is it on this picture that I can only see a sliver of blue?
Most of the attaches on the anterior side.
Right, because most of the fibers of the deltoid are on the front. So the deltoid does abduction, and it does some shoulder flexion. Right, because it's attachment points. All right, now, I have not mentioned this one yet, so let's talk about it. This large muscle of the back, which I have a picture coming up momentarily, is the trapezius. The trapezius also shares attachment on the spine with the deltoid, but they're not on the same place. Can y'all see that? The trapezius is across the superior border of the spine, the deltoid is across the inferior border. Now the trapezius has a number of attachments. So I have them listed for you here. They're on your handout as well. You'll have to memorize them. The occiput, the occipital bone, near the external occipital protuberance along the superior nuchal line is the attachment here of the trapezius. It's on the head. And it's attached to C7 all the way down the thoracic bones to T12. Now, why, students of anatomy, why do I not have C1, C2, 3, 4, 5, and 6 here? I know you don't know the answer to this. It's a rhetorical question for me to answer. If I know that the muscle is attached to my head, it's on the occipital bone, and it's on my back, and it's attached to the spine of the scapula, and I know that it's attached to the spinous processes of C7 all the way down, C7 all the way down to T12, then why is it not attached in the upper portion of my neck? So you learned the vertebral bones and you learned the scapula. Between them are muscles. There are no bones. The only bone keeping the pectoral girdle lateral is the clavicle. No bones back here. So all that mass on my back between the scapula and the vertebral bones is soft tissue. So somehow, are you telling me the muscle is just hanging? It's just hanging there from the occipital bone? Well, it's not. It most certainly is not. What you're going to see in the description of the attachment, I'm going to show you a picture of it here in just a minute. If I warm you up now, you see the picture, you go, got that. There is a thick ligamentous band that extends across the spinous processes of the first 6 bones, called the nuchal ligament, or the ligamentum nuchae, a thick band. And the trapezius actually fuses to it. So I'll show it to you. All right, so the trapezius we're going to talk about, I should show you a picture of that one. The rhomboids, if I tear off the trapezius muscle, which I will do, I'm going to show you, then underneath I will find the rhomboids. The rhomboidus major and the rhomboidus minor. Notice the minor is blue here and the major is blue here. So what that tells you is that's the part that's going to move. That's the part that will move. So if it's going to move, it will move toward its origin. And in this case, the origin is on the spinous processes of the cervical and thoracic bones. C7 and T1 for the minor, and T2 to T5 for the major. So if you put it from the spine over to the scapula, and this part moves toward that part, this is the medial motion of the scapula. This is the medial motion of the scapula, moving the scapula toward the vertebral column. The rhomboids are the primary muscles responsible for that. Okay, now you've seen already the teres minor. The major also has an attachment here. The teres major should be right. Oh, it's on the front side, right. So you won't see it here. The teres major goes around to the front. But its attachment is here also on the scapula. And the last one I've mentioned already to you, and then we'll start looking at the pictures, is the levator scapula. The levator scapula attaches to the superior medial border. Did anybody pick it up? Did y'all pick it up when we were talking about it earlier in the class period? I showed the first thing on the scapula. Look here at the superior medial border of the scapula. It's going to be an important spot for the levator scapula. It's going to have attachments to C1 to C4. Now those attachments, incidentally there, are not to the spines. Those attachments are out on the transverse processes of the cervical bones. So what does the levator scapula do? This is This is deltoid. This is deltoid, right? This is rhomboid major and minor, right? This is levator scapula, right? To elevate the scapula. So I'm moving the scapula around with these muscle attachments. All right, here they go. Trapezius first. The trapezius has an attachment to the occipital bone and to the spines of C7 to T12. From C7 to T12, the tissue is fused into the spinous processes. What about from C6 to C1? Is this part of the muscle attached to the spinous process? No, it's not. So just deep to this fascia here, is the ligamentum nuchae. That's why it's not on here. It's also attached to the clavicle and the spine of the scapula and acromion. Where is the trapezius attachment to the scapula in relationship to the deltoid? The trapezius attachment to the scapula. They're both on the spine, right? But they're not fused together. The traps are on top and the deltoids are on bottom. This one wants to go to the arm. So the trapezius here is attached across the superior border there. All right? Good. All of that. Here's the levator scapula. The levator scapula is attached here to the medial superior border and attaches to the transverse processes of C1 to C4. Can you see now why that is more transverse process? What is the name of that thick band right there? You see where it ends? It ends right here at C7. These are the rhomboids. There's the minor and there's the major. The trapezius has been taken off now. I'm looking underneath. What is that? That is the nuchal ligament right there. So there's the nuchal ligament attached to the trapezius. It ends at C7. Here are the rhomboids right here. There's the levator. What's the name of this muscle? What's that one? That's the acromion. That's the spine. That is the supraspinatus. What's that one? Infraspinatus. What's that one? There's minor. Levator scapula. Splenius. Semispinalis. Okay, we'll do those. We're coming to them. All right? So here are the rhomboids. I just showed them to you. Rhomboid minor and major. And here are their attachments. The major is from 2 to 5, shown in red here, to the medial border. And C7 and T1 for the minor. Rhomboid minor and major. All right, let's do the arm, and then I'm going to shut up for the day because this is the last piece that I've mentioned to you in preparation for this. So over here are the attachments of the bicep brachii. Do you recognize the coracoid process? What's the name of that process? That's the acromion. What is the name of this cavity right here? Glenoid cavity, that's the head. What's the name of that? Greater tubercle, and that is lesser tubercle. This is the radius. What's the name of that piece right there? Radial tuberosity. So this is the two-headed bicep muscle. The long head of the bicep is the lateral head. I would have called it lateral. No book calls it lateral, but it is lateral. So can anybody see on here why your teacher would want to call this lateral and not long? What? It's on the lateral side. There's another reason. If one muscle is longer than the other one, I have a two-headed muscle. And I look at the images in my text. Does in fact short and long fit for you? Does everybody see that? If I follow the short head up right here to the coracoid, or if I follow the long head up, do you get the impression that the short head is actually longer than the long? That's what it looks like. Y'all see that? Now, in truth, the long head is longer. But the only way really to demonstrate that to a student would be to cut the attachment off for both heads and lay them down so you can see it. So if I'm an anatomist, you see what I'm saying? I'm going to teach the kids lateral and medial here. But no text does it. It's things that bother me. Okay, so you have to learn them this way. They are the long head and the short head. The long head of the bicep travels through the intertubercular groove and attaches to the rim of the glenoid cavity. Does the long head of the bicep brachii do anything for stabilizing the joint, the shoulder joint?